Dr. Alex, can you hear okay?
Yes, Lisa, I can.
Okay, and you can see the screen that is professionalism in medicine attributes expected of healers.
Yes, ma'am.
Okay, sounds good.
All right. Can you hear me okay, Lisa,
I
too?
can. I
Okay,
can.
very good. Thank you.
Good morning, Dr. Krishna.
Morning, Lisa. How are you?
I'm doing well. How about you?
Great. Thank you so much. I
Good.
appreciate you making all the arrangements.
You bet. I can see you okay. I can hear you okay. Can you see my screen okay?
Yeah, I can see you
Okay.
very good.
Okay, great.
So the slides will show in the center part. Is that right, Lisa?
Yes. Do you see this that beginning slide?
No, not yet.
You don't?
I don't see it.
Um,
Jenny,
Good morning, Dr. Krishna. How are you?
great, great. How are you, Dr. Alexopoulos?
I'm well. How are things?
Things are going well.
Very good.
Yeah, thank you. Thank you.
Happy New Year.
Happy New Year to you. Thank you.
Thank you.
Now, Dr. Alex, you can see the screen though, correct?
Yes, I can. I can
Okay.
see the screen.
It says Lisa Cummins has paused screen sharing.
Oh, it does?
Yeah.
Oh, okay.
Yeah, now I see it.
Now you see it. Okay. All right.
What magic did you do?
Well, if you want to know the truth,
Uh-huh.
I had everything all arranged, and I was fixing me some water, and I spilt my water,
Uh-huh.
and I started cleaning it up, and I think I hit a key on the keyboard. And then when you said that, I realized what I'd done. So if you want me to be honest, that's what happened.
Thank you.
I
Thank you
was
so much.
shuffling to wipe up the water.
Oh, thank you. Thank you. Oh my goodness.
What a way to start the day, right?
That's awesome. Awesome.
It's only up from here, so.
That's right. Uh,
So in a couple of minutes, Dr. Krishna, I will introduce you so
okay.
we can get started at the top of the hour.
Okay. Thanks. Thanks so much.
You bet.
I'm still serving on the Board of Health, Jenny, and I think I'm going to call it quits.
Is that right?
Yeah, because it's been what, 18, 19 years?
19 years, I think, for you. Yes.
Yeah.
Wow. So you've done a fabulous job. I'm sure they just really enjoy your leadership and enthusiasm.
Thank you so much. I appreciate you. You've set the trend. You've been the torch, you've been the torch bearer. Yeah.
All right, we'll go ahead and get started. Good morning, everyone, and welcome to Grand Rounds. Our speaker today is Dr. Murali Krishna. Our program today is underwritten by an educational grant through OSU Medical Center, Graduate Medical Education, and a disclosure statement has been signed and is on file in the Graduate Medical Education Office. Dr. Murali Krishna is a well-respected senior psychiatrist in Oklahoma City. He is widely recognized for his dedication, his compassion and mind-body expertise and skills for helping people achieve their true potential of emotional wellness. Dr. Krishna is a community ambassador and a board member for the Arcadia Trails Integris Center for Addiction Recovery. He also serves as the founding president and board member for Integris James L. Hall Jr. Center for Mind, Body, and Spirit, an educational organization that's been devoted to improving the health through raising awareness of the healing power of the connection between mind, body, and spirit. He also served as past president of Integris Mental Health. In 2010, Dr. Krishna and his family established the R. Murali Krishna Family Eliminate the Stigma Award to honor individuals and organizations that have shown outstanding contributions to the community by eliminating the stigma surrounding mental illness and improving the lives of those affected by mental illness. The respected award is given annually at the National Alliance on Mental Illness, Oklahoma Walk in Oklahoma City. Committed to improving the health of people in our communities, Dr. Krishna believes that each one of us has a responsibility to care for those in need, and he is grateful for the opportunity to create lasting positive changes in people's lives. He is an expert on emotional wellness, the mind, the body, the spirit, and the connection, and how each one influences the other. Through his mental health and addiction recovery services, he has become an innovator and a champion for the people of Oklahoma struggling with mental health. He is often interviewed by television and print news organizations, and his tireless efforts have earned him numerous national and international awards and recognitions. Dr. Krishna was bestowed with the prestigious honor of Distinguished Life Fellow which is the highest recognition given by the American Psychiatric Association. And with the assistance of his good friend, Kelly Dyer Fry, the editor of the Oklahoman, Dr. Krishna wrote an inspiring and educational book entitled Vibrant: To Heal and Be Whole, From India to Oklahoma City. While working together on this project, they discussed their shared dream with each other and the community-minded visionaries of developing a world-class center for addiction recovery here in Oklahoma to address the crisis of addiction, mental illness, and trauma. Their dream became a reality when Arcadia Trails Integra Center for Addiction Recovery opened on May 28th of 2019 on the Integris Health Edmond campus. Dr. Krishna is one of the 4 founding visionaries. Our CME iCloud activity code for today is 3989. That's 3989. Please join me in welcoming my great colleague and friend, Dr. Murali Krishna.
Thank you. Good morning, everybody. Thank you for joining us today, and thank you for inviting me to talk about this important topic. As you know, the trust in physicians is paramount for any healing to occur in a good way. And lately, in the last few years, the trust in physicians and medical profession in general has taken a hit. And if you look at the Gallup poll, other polls, only about 53% of the general public have full trust in the physicians today. So we need to look at what is this trust level, how can we build it, and how can we practice it, and how can the hone the art and the heart of the trust. And I'd like to introduce you to the word professionalism. We are all professionals. You know, you have worked hard all your life, most of your life, in studying and in doing hard work, in doing rotations and learning from teachers and books and research, and to become a professional that you are today. And where does this word professionalism come from? What does a professional mean? So now we'll look into all aspects of that. And I would like you to remember, especially the trainees, that you don't become an expert in professionalism overnight. It's a multi-dimensional competency that you develop over a period of your career by learning, by practicing, by applying the principles you learn, and then sharing and learning together. You know, it is a core of observable behaviors that you can observe. It's a core of values that you are born with, that you raised, and that you inculcated within yourself and those around you. And we'll talk about that. Next slide, please. Learning objectives, as we talked about, define professionalism in healthcare, learn the key attributes expected of physicians, discuss various modalities of learning professionalism, and also the assessment strategies for professional behavior. Next slide, please. I will not make it just a presentation. I'll share some of my experiences as a young physician 50 years ago, 55 years ago, when I became a physician. And as I learn and what I've learned through various key moments in my life, and I'll share that with you, both as a physician and as a physician leader in this community for 51 years. Trust is essential in all patient interactions and relationships. It is expected of you by the patients, and so it's very important. That leads to good adherence to treatment, better outcomes and patient satisfaction, improves safety and quality, helps you to develop into more compassionate, competent, wise, and a caring physician. And that's very important. Trust is crucial to any healing to happen. And for us to really experience trust, there've got to be certain parameters one has to meet. And we'll talk about that. Next slide, please. Lisa, can you get me next slide? Lisa, can you get me next?
Yeah, sorry, Dr. Krishna, it's not advancing for some reason.
Okay. Yeah,
There we go.
Yeah, great. There are many, many definitions of professionalism. Mayo Clinic had this definition, engendering trust by doing the right thing for the right reasons, in the right way, at the right time. It's as good a definition as I've seen. Many institutions have different definitions, but ultimately boils down to the word trust. And that is a key component of everything we're going to talk about: trust and connectivity and healing connection. Next slide, please. So what are the core components of professionalism? The word profession comes from the Latin word in the 15th, 16th centuries. What it meant was people that profess to be in a profession, they have accumulated expertise, knowledge, and wisdom in a certain field, like in medicine for us, for our field. And also they're professing, that means openly vowing, openly promising that they will do the utmost service in the best interest of the client, in our situation, the patients, and also with ethical integrity. And that's what professionalism means. And it means integrity, honesty. We'll speak our heart, the truth, and we'll share that. We have integrity. Over a period of time, we develop integrity and show integrity that can be seen behaviorally by other people. We take responsibility, and when we take responsibility, we remember to deliver the goods what we promised we would do. Even though it may not be complete healing in every patient, it could be treatment could be limited, could have limitations at some point. But reliability, you're reliable, you're consistent, and you're reliable. And you show respect and empathy to the patient. That's very important. No matter what economic background, no matter what age they are, no matter what social condition they come from, always show respect to the patient. Patient is up on the pedestal, put them on the pedestal. Empathy, you identify their feelings and their state of mind, and you connect with them at that level. You may not feel the same way all the time, but for a minute, enter into their world, see what they're going through. That's a very important skill that one can develop. We may not be born with that skill. We have some other skill, but we can evolve and emphasize and enhance our skills for empathy by practicing empathy. For a moment, no matter what your stance is on each issue, no matter what your political belief system is or personal belief system is, for a moment, step into the other person's shoe, look at the world through their eyes, and feel the feelings they have and concerns they have and the hopes they have, just for a few moments. They'll give a wonderful perspective of their world to you, and then your world full of expertise and knowledge and wisdom can meet together and offer some solutions for their recovery and healing. Pursuit of excellence through lifelong learning, like you're doing right now. Not everybody is born with 100% professionalism. We all evolve over a period of time, and we all evolve into the excellent professional over a period of time. It's a work with a cohesive, connected teamwork in caring of the patients. Always have the team. You're not alone. We are part of a connected network of healing providers and hospitals and healthcare systems and labs and pharmacies, and work with each other in connecting with each other. A lot of the times the problems come when we are not connected to each other. A patient sometimes may be seeing multiple providers, and if we are not connected with each other and sharing with each other, that will leave a big hole in their care, a comprehensive care. Altruism and advocacy, we'll get into that later on, because eventually we need to show our kindness and compassion to the patient and to the community, and become a partner in developing what needs to be developed, become an advocate for utmost care of the patients, and offering the health care to the community in the best way possible within the limitations we have. Next. Also, we need to remember not only our own personal professionalism, we are all working with systems, and the systems have systems level professionalism today. We're not a lonely doctor like I was in the beginning of my career in a small town with no connection anywhere. We are all part of a bigger system that's bigger than us and multiple other specialists and care providers. So help develop and sustain quality and safety systems. That's part of the systems level professionalism that we need to take part in. If we don't develop safety and security and quality systems, then the system would not give its best service. So we are partners with the system. and error reduction. Errors will happen and can happen, but reduction is the name of the game. We need to consistently strive towards error-free care and improve the procedures and the policies to get to that point. Stewardship resources. We may have one wonderful treatment for one patient, and that may exhaust all the resources we have, or the system has, or the insurance company has, but 1,000 other people may not be able to get any treatment at all. So we need to find what's the right balance. There are marvelous treatments in genetic engineering and implantation and CRISPR, but they are so expensive. How do we balance how to get the treatment to what's available in the community, in your system, within your purview? So we need to have a dialogue about that. That's why you have ethics committee. That's why you have peers and supervisors to discuss with those issues that offer some conflict. Advocacy for change when needed. It's very important. Many professionals, medical students and residents and fellows and young faculty do not completely realize what a powerhouse they are. We are all little atoms waiting to be smashed to unleash that tremendous energy that you have, because the society trusts you for the most part. They listen to you if you speak. They support the advocacy that you are advocating for the better patient care, better patient delivery. And I can give you many, many examples in my life. I come from 12,000 miles away. I came to Oklahoma 51 years ago, and I found out that, in Oklahoma City, there was not as much volunteerism as I would like to see. So in 2005, when I became county medical president, I wanted to use my professional capacity to see if I can create something new that we did not have. And there we created together Health Alliance for the Uninsured, people that do not have insurance. I found out nearly 1 in 5 Oklahomans do not have any insurance coverage, and they are devoid of health care. The only care they get is through emergency room, and which is not the ideal care for most people. So we formed a Health Alliance with the help of the community, with the help of the local corporations, with the help of local healthcare systems, and with the help of the local educational systems. It took about 2 years to really develop the whole thing. And then I went to the legislature and advocated for Senate Bill 930, because a friend of mine, Dr. Polofsky, told me, Murali, you can get all the healthcare alliance you can form, but if you don't really take care of the malpractice situation for those that are giving care out of the goodness of their heart, you will not get anywhere. So we advocated for very, very good coverage for those people that give their service, physicians and nurses and other practitioners, and we offered near perfect protection for them through Senate Bill 930. Initially, it was very difficult to really break through, but medical students joined me, other physicians joined me, and we got it approved 99 to 1. And then the governor tried to veto it, and we overcame the veto. And finally, it is law. For 21 years, it is law. Senate Bill 930. It covers in Tulsa, Oklahoma, and Stillwater, Oklahoma, and everywhere we are covered by Senate Bill 930. When you're giving your time and your resources and your expertise out of the goodness of your heart, you have wonderful coverage through our state law, Senate Bill 930. Not even one malpractice suit filed in situations like this in the last 21 years. And that's commendable. In the volunteerism here in Oklahoma City increased from 35 physicians to 250 physicians. We work through 22 free clinics, and hundreds of medical students and nursing and public health students volunteer each week in these clinics. So advocacy, it is not to glorify what I've done. I was just a catalyst. Everybody else joined me when they found that that's a good cause. So advocate, you have so much more power collectively. So get ideas how we can improve the system, how we can advocate for people that don't have advocacy, and how we can have better satisfaction overall. Next slide, please. So how do we learn professionalism? The most important part is direct observation of experienced physicians, interactions, behavior, decision-making, and communication. In my younger part of the career, I had a great mentor when I was a medical student, and then a great mentor when I was an internal medicine resident. wonderful doctor that was an expert in internal medicine, that not only through his knowledge in the brain, the man was so kind and empathic and connected with each individual he comes into contact with, whether it's a patient or a nurse or a family member. And after he made the connection, then he would really, was magical in the way he communicated, and in the way he made decisions, in the way he made patients feel part of the decision making and as a partner. That really, really mesmerized me. And I didn't have those skills when I was born or when I was raised. And I learned that by the hard way. And he was a great mentor for me that I remember each day, even today. So observe your superiors. You have an excellent example right there, Dr. Alexopoulos. Jenny and I worked together as board members at the Oklahoma State Board of Health for nearly 2 decades. And she was a great leader, not only a board member, but as a board chair. She's an outstanding leader. She listened to people. She took their concerns into consideration from statewide, and she had generated the wonderful dialogue among the board members, and she made the right decisions when they need to be made and took the leadership in doing so with grace and dignity and great articulation. She is one of my heroes as far as leadership in medicine. And thank you, Jenny, for the great work you do. Like that, you have so many good people in the osteopathic medicine, both the school and practitioners. I watch many people every day today. They're great role models for you to learn from. Formal didactic lectures like what we're doing today. Role playing, small group role playing is a wonderful way of overcoming some questions about how do I deal with the situation when you have a conflict, when you have a difficult decision to communicate, when you have a bad outcome. Role playing is going to be a great way to do that. There are also many learning modules in all these skills. So a supportive learning and sharing small group discussions are one of the best ways of doing that. Do it once a month or once every 2 months. Attend the ethics committee meetings and find out what issues are bothering the institution or people. So use all the learning modules you can to become as much an expert as you can. Next. Excessive burnout and professionalism. This is very important. I think maybe 2 years ago I gave a talk. I think you should have it in your library on burnout, and stress and burnout is really affecting at least 1 in 2 physicians throughout the country. It has become more since the time of COVID. In the last few years, it's gone up. Many physicians are prematurely retiring, and their life is affected by stress. When you have excessive stress, eventually leading to burnout, your thinking, your empathy, your patience, your judgment is all affected adversely. So it's important to learn to identify when stress and burnout are affecting you. Please listen to that module from about 2 years ago. I think Lisa can make it available to you. How do you identify it? What symptoms do you have? How do you take action? What can you do every day in terms of practice? How to get the inner stress system to tone down? There is a healing system hardwired within each one of us that in the talk I'll share with you how you can activate that. Every one of us can do that. Please listen to that and practice. Learn skills to cope with and recover and rejuvenate yourself. Just like the heart muscle, it beats with every systole, there's a diastole. It doesn't wait till the end of the week to take a weekend off. The heart continues to beat from the moment of birth to the moment of death because it's rejuvenating, recapitalizing its inner energy and get the strength back for the next beat. Same example for the human brain and human mind and human body. We need to rejuvenate ourselves. You've got to sleep well. If you don't sleep well, stress and burnout go high. You've got to have balance in life, not just patience. I was ignorant for a while about the role of stress in the beginning part of my career because all I had to give was the profession I have and the skills I have. So I was spending 14 hours a day, 12 hours a day, ignoring many other things, including taking care of myself. And one day I came home around midnight, 12:30, and collapsed in my bathroom. My wife had to take me to the emergency room. I had an appendix about to burst, and they did emergency surgery. And I realized I need to make some changes. So from that moment onwards, consciously, I made a change in how I schedule things, how much I work, how much relaxation I have, rekindle my hobbies, tennis, and many other hobbies I have, and spend more time with the children in the family, more time in the community activities. And so I had the right balance, and that did work for me. And then I was able to also help many, many people to get their balance back in my profession. Part of my career has been helping physicians and medical students and healthcare professionals regain their own health and happiness. When you have any unresolved feelings, anger, frustration, uh, you know, the the inner body and the mind and the brain, they activate certain systems that will not be conducive to good attention, good empathy, good patience, good judgment. If you have one angry episode, then your chance of having a heart attack goes up by 230% in the next 2 hours. Studies are showing that, you know. So every emotion, everything that you feel has an effect on the body at the cellular level. So we need to recharge ourselves and rejuvenate ourselves. Healthy body and healthy mind and healthy spirit are essential for all healers and all healing. And that's what a balanced mind, balanced body, and balanced spirit are essential for any healing connection with the patients and families and colleagues. Next. So, key teachable skills. What can we teach? I think we are missing a slide. Okay, no, this is good. Next slide, please. Yeah.
Okay,
Sorry, Lisa.
no problems.
Key teachable skills. This is important. These are teachable. That means every one of us can be experts in these areas. We learn how to learn or where to find the learning process. And self-awareness, awareness of who you are, what your thoughts are, what your goals are, what your passion is all about, what things are bothering you today that could interfere with what you could be doing with the patients. Because one of the most important things is learning to put the interest of the patient above your own interests. So if you're tired, if you're, really angry about something you're not able to resolve, you need to pause for a minute and see how you want to deal with that, and then have a game plan, and then connect to the patient. Otherwise, those unresolved feelings, those unresolved issues, they will interfere with your attention, awareness, and the healing process and the connection that you have with the patient. Self-control, we can learn, it's a teachable skill. And dealing with emotions, dealing with impulses. It's very important for us. Our needs take backseat when you're in touch with the patient. Situational awareness, where you are, what situation around you is, what are the circumstances around you that are interfering or influencing the present process of healing between you and the patient. Communication in a crisis situation. We've had many, many crises in Oklahoma, and this is very important for us to learn how to communicate and have a game plan for communication. I remember 1995, April 19th, the Oklahoma City bombing. I was just elected as chief of staff at St. Anthony Hospital with 800 physicians, and I did not really have much training in leadership or communication, and we learned by the seat of our pants. Thousands of people came to St. Anthony Hospital, hundreds of people injured, and about 160, 170 people died. It was a disaster galore, the worst terrorism act on the US soil at that time. All the media showed up and they're wanting information. CNN, BBC, ABC, NBC. The government showed up and the firefighters and Physicians from all the hospitals, they wanted to come and help. Nurses came and helped. The whole community showed up. One of the most important things I've learned is the beauty of Oklahomans right there during those few days. If you look at the bombing of New York City or London bombing number one, number two, the Africa bombing, the Mumbai, India bombing, people were running away from the bombing site as fast as they could. In OKC bombing, if you have a helicopter view, you would be surprised to find that people are flocking to the bombing site. They want to help. There was a blind man who was going there back and forth, trying to rescue bodies with his stick. And then finally, some big block of cement hit him and he died. People want to help. People want to rescue people, even though the police and the emergency workers are trying to get them away from the bombing site. A nurse from Guthrie, Oklahoma, 32 years old. I knew her. And she just delivered twins a few weeks before. And she was going there in the trouble, rescuing people, bringing them out, even though police would cordon her off. Finally, a big cement block fell on her. She died. That's Oklahomans. That's the beauty of Oklahomans came to my awareness at that time in a very major way and had a very big impact on my life. From that moment onwards, I made a decision. I want to really do things for the community, not for myself. I stopped going for elections for president of this or chairman of that and started seeing how can we create permanent institutions that may add value to the life and the health of Oklahomans. From that moment onwards, my life course has changed from me to how I can make an impact in the community and how we make a difference for other people. That gives me more satisfaction, fulfillment than anything else that it can give me. So that was a change moment for crisis communication was important. When we're communicating in that crisis situation, you have to have protocols, you have to have prioritization. The ER was filled with people. And who do you take care of? The sickest person or the VIPs that came through with a minor injury? Those kind of discussions you have to have. And how do you handle the media? It's amazing how many media companies set shop there and wanted to come to the hospital and interview patients and doctors. How do you deal with that? Bob Arnott from ABC News was following me for 3 days, day and night. And then he said, I want to do a story on you. And I said, for about 3-minute piece. So I told Bob, I'm not the hero here. The patients and the injured and all the healthcare workers are heroes. So you divide those 3 minutes you reserved for me to 3 stories. I'm going to take you to the patient. So I took him to patients in different floors that agreed to be interviewed about what's going on. And that beautiful story was broadcast all over the country about these 3 patients, their families, and how they are coping with that. How do you deal with conflict resolution? You have opposing views happening all the time in life. In medical practice, not every condition has a specific treatment. That's 100% true. There are many controversial ideas, conflicting ideas. One doctor has one idea, another doctor has another idea. How do you resolve those conflicts? How do you resolve conflicts about scheduling, about what treatments to offer, what resources we have? Conflict resolution is an important thing every day. At the administrative level, we're talking about professionalism, not only in physicians, I'm talking about at the research level, medical education, and also administration of the healthcare systems. The conflict resolution is happening every day. We need to learn how to identify what conflicts are, how we can agree to disagree, how we can help each other understand each other's position, and try to come up with either a compromise or a reasonable solution that is best for the patients and our community. Cultural competence is very important when you're dealing with different cultures, as our nation is dealing with. Emotional intelligence, connecting with people, not just at the intellectual level, but at the emotional level. Understanding each other's feelings, identifying each other's feelings is very important. Mindfulness. I taught in the previous module the principles of mindfulness. If you ask me, Dr. Krishna, tell me one thing that'll make a big difference in my life, in my professionalism, I would say mindfulness. And you may be surprised to hear that because mindfulness encompasses most of what we're talking about today. Mindfulness is cultivating your own awareness without judgment and being in harmony with this moment right now. Cultivating your own awareness. You're born with that. You were mindful as a baby, but somewhere along the line, we lose most of the mindfulness and become mindless. We are looking at somewhere, we're thinking about something else, our hands are doing something else. We think we have multitasking capability. We don't. The brain has capability to change the task from one to the other. It does not have the capability to do multitasking. We think it has. It does not. So there are specific practices you can do to hone in and cultivate that mindfulness intentionally, starting from your own breath to everything you do on a daily basis, from touching the patient's hand to making an eye contact, to communicating mindfully, and to being fully present. A half an hour appointment in which 20 minutes of the time you're looking at the computer and talking to the patient is not as good as maybe a few minutes of eye-to-eye contact, a few minutes of honest communication, sitting and talking and connecting with each other, and then do some computer work as we all are required to do that. That's okay. But connect with the patient. The healing connection is very important. And if you learn how to be mindful, you'll have healing connection in every moment of your life. This is a learnable skill. Every one of you should master it, in my opinion. And if you are not able to find the module, let Lisa know, and we'll see what we can do. But this is something that I really wish every one of you master before you finish your training programs. It offers a number of benefits to you in life, including prolongs your longevity. It has got tremendous effect on your health. Studies are showing all over the place about the effect on cardiovascular system, positive effect on inflammatory system, immune system, and brain. Dr. Sarah Lazar from Harvard has a beautiful study on the brain scans showing that 8 to 10 months of mindfulness practice will result in increased gray matter in the brain. Can you believe that? I don't know of a single procedure or a single surgery or medicine that can increase gray matter in the brain. But as simple as mindfulness practice daily can increase some gray matter in your brain. So research is showing that. Next slide, please. So, pause and ponder. This is very important part of professionalism, and we need to evolve into that. And dealing with family and friends it's a very simple thing. If you ask an average doctor, he said, "No, don't deal with family and friends because that's you lose objectivity." But what if you are the only physician in a rural community, which is one day away from any metropolitan area, and you have to deliver the baby of a family member? What if you have to give vaccines to your children when there's nobody around you? And these are conflicting situations we need to get clarity about and have discussions about. In my early career, back 55 years ago, I was a family doctor in a small rural town with no healthcare in sight for 200 miles, and which at that time took several hours. So I had to vaccinate my own children, and which I wouldn't do today, because if I didn't give vaccination, they won't have the vaccination, children. By the way, one of my son is a physician in Tulsa, and he survived that vaccination. So congratulations to him. But in general, avoid caring for the family and friends. Why? Because your objectivity is not going to be there, because you're so intertwined with their life, with their emotions, with their feelings, that you may not be as objective as you could be if you're not your family or friends. Sometimes, pain management becomes an issue. Do you give any medicines to your family? In general, personally, I wouldn't recommend any of us giving pain medicines. Narcotic pain medications are bad news because our objectivity may not be there. There have been many, many cases of disciplinary action against physicians for activities that involve loss of objectivity with family and friends or acquaintances. So we need to be, ethical and just pause and ponder when the situation comes. Discuss with colleagues, and don't get into dysfunctional situation whereby your judgment is impaired. Social situations in public, how do you deal with that? It's a very difficult issue because, especially in some fields like psychiatry, I practiced psychiatry for almost 5 decades. In my branch in psychiatry and behavioral sciences, uh, we are not expected or supposed to even acknowledge a patient in the public. A person may be seeing me every week for therapy, and I know intricate details about their life, and they know something about me, and they've shared their inner secrets and their fears and their hopes and their plans. But still, my principle has been always, until they acknowledge you, don't acknowledge them, because you don't want to reveal in public any information. Even the fact that they're seeing me is not going to be positive, because you're revealing something that they are not revealing about themselves. If they choose to talk about it, that's their issue. That's their right. So the information is really patience. And so deal with that in a proper way so that you will be a good professional practicing professionalism. And do not share any information about patients to others. That's a very important thing. The human being always is itching to share some secrets, some things that are going to happen. And you see very important people that are decision makers in the community. I've seen the governors of Oklahoma. I've seen very important people. But not a thing is known to a second human being who I was seeing and what I was talking about. And it was tough sometimes. But you've got to profess by the ethical standards that we set for ourselves. Remember, the community gave us a license to practice medicine through the licensing board. And part of the contract is that in return, you're vowing to practice medicine ethically and to hold the public in your trust and have earned their trust for you and look out for what's best for them. That's very important. When feelings overwhelm you, you're dealing with acute loss, grief, intense anger, intense frustration, and you're dealing with a situation where you think something else should be done and that's not being done, and that's out of your control as to what's being done. So when these feelings overwhelm you, it's important that you realize it, become aware of them, whatever feelings they are, where they're coming from, recognize them, see what you can do about it, discuss with a colleague, a trusted colleague, discuss with your supervisor, discuss in a small group meeting or ethics committee. Whatever you have, please seek some kind of assistance. And that's going to be important. When your feelings overwhelm you, that's where mistakes happen. And that's very important for you to carry on for the rest of your professional careers. Even simple things like driving a car. Can you believe if you're driving a car and then you're looking at the messages on your iPhone, your attention span, studies are showing, is equal to somebody that is intoxicated with alcohol, because it takes a millisecond to have an accident, endangering other people. And no matter how attractive it is to, just it's a message, I'll read that message, or I'll just call this person. It does put somebody else in danger. And your decision that you're making may not be the best decision also in that nick of the moment when you're also driving, operating a very, very sophisticated machinery. Stop somewhere, return that call if that's urgent. Do not drive and look at the iPhone. I see a lot of physicians doing that. In my opinion, that's not really good. Pause. Just takes a couple of minutes to, stop the car and then look at it, rather than endangering yourself and other people. I think it's common knowledge. Do not drink and drive. Do not take drugs and drive. And we do have a significant number of people still impaired. We have an impaired physician committee at the State Medical Association, and that gives very good counseling and proper treatment. And in the beginning of my career, there was no impaired physician committee. And we had one very respected physician came to St. Anthony Hospital in totally intoxicated state and with a medical emergency. And at that time, after he recovered from the medical problem, family and I had a conference with him, and we wanted to send him to a treatment. And he threw a fit and said, I'm going to ruin your life when I come back. So he went there. And that gentleman became so wonderfully equipped with the knowledge of how to keep people sober. And so he became the spokesperson and started the impaired physician committee meetings at his own home and became the pioneer in Oklahoma. So we have a robust impaired physician committee that deals with that. You know, by the way, mindfulness has a very big impact on the impulse control. We're finding in the Arcade Trails treatment program, vigorous mindfulness training decreases the need to act on the thought before you ponder, and it gives you a pause, which is really valuable. So disagreements with colleagues and other professionals, it's not uncommon at all in the hospitals and health systems. We need to understand the points on which we are disagreeing with the colleagues and others. We need to have a decent way of communicating with each other without too much emotion and have a discussion. And we need to have a game plan, how we're going to have action plan, how we're going to resolve it. That's going to be an important thing for any good professional. How do you deal with social media, artificial intelligence, and privacy? It's a whole new ballgame with the AI. Now I see that AI is recording the patient interactions and developing beautiful reports, which is a big relief, for any doctor, because we are spending so much time in the computer taking notes. And I'm glad to hear that the modern technology is offering us some wonderful clues how we can better spend our time. But are we looking into the privacy issues? Where is that information going? Who else has access to that? And did the patient give permission for us to release that information to the cloud out there in the world? I don't know. We need to have discussion about it, and you probably are having in your hospital systems. We need to look into that, AI and privacy, because I learned that Chat GPT, whatever you share, is going to be in their cloud, accessible to many, many people that you do not know who they are. And from then onwards, I'm pausing now before I ask Chat GPT. I'm not very computer expert, so we need to look into that more closely. But the main thing I'm coming at is patients' privacy is paramount. Part of the respect you show to them is dealing with their privacy with respect and dignity. And that's very important. That's their property. Only with their permission, you can release somebody. How do you deal with social media? Many doctors help social media and help people to understand conditions, treatments, and that's a wonderful thing to do. But do not reveal any patient identity, even the clues as to who the patients are. It's good to help community understand health concerns and medical problems and possible treatments, but it's not okay to reveal confidential information that's revealed to you through your patient interactions. Even if you're not a psychiatrist, even for general medicine, I would be careful about that, because that's not going to be good practice. Next, please. So, how do you assess the professionalism? Direct observation. If you look at somebody examining the patient, taking history, examining the patient, and doing the differential diagnosis, doing the lab work, and coming back and giving them feedback and decision making, you will know very well how professionalism is there or not in that interaction. Direct observation is the best way, because the core values show up, the observable behavior show up, and there is also multi-source feedback from the colleagues, from patients, from nurses, and other health professionals. There are also many measures on professionalism observations, and also reflection and remediation. How do you overcome any areas that you need to really strengthen? How do you remediate that? And I think your supervisors can point out how to remediate that. There are many people that have learned how to do that. I want to give an example. In my own life, I wanted to be an engineer as a young child, and math was my subject, and I was very good at that. And then at the age of 9, suddenly my mom became very ill, and she had an illness of the brain or mind. We didn't know at that time what. That took her away from regular life. She was very unhappy, miserable, depressed, withdrawn. Normally, she's a very wonderful, loving, caring, talkative person. So our whole family life came to a standstill. Nobody understood what's wrong with her. That's the 1950s, and doctors didn't have treatments. Society ostracized her, along with her, us, and we went through a lot of pain for several months before any possible help could be obtained. So that pain that she was going through, I found her about to drown one day, and a little boy came and rescued her in my little way. And she was going through so much pain that touched my heart and my spirit in a very major way. I wanted to be a physician. I wanted to find out what's wrong with people like my mom. That's why at a very young age, I went to medical school and then went into brain sciences in England and then here, mind and brain sciences. So when I went to practice, that impact I had from childhood had an effect on me, because if an insurance company declined care for a patient of mine, I would get very upset, and I would throw a fit and I'd become angry and I'd call them and chew them out. And then after a few interactions like that, I realized I'm losing my objectivity. I'm seeing my patients as if they're my moms and trying to fight for her cause, like I was as a helpless child. I couldn't help her as much. And that clouded my judgment. So I realized that I need to become more calmer and try to find out why they declined the care, what clinical information they need, how I can convince them in a more respectful way rather than putting them down, and how we can have a decent relationship with insurance companies that gives you what you want, that is a good care for your patients. And that I had to learn the hard way. And the good news is, after a few years of fighting with them, they never gave me any troubles about any of my patients for a long time. So I want you to know that many factors in our life, even from early life, may affect your judgment. So we need to have time to reflect and remediate them. They're all remediable problems. Next slide, please. So on a daily basis, what is that you do? Simply put patients' interests first. Put patients first. You're serving a noble cause. You have a calling to serve a higher cause than yourself, and that comes in the form of your patients and their families. Put their interests first every day, every moment. Speak truthfully to yourself and to the patient, even though the truth may be painful or difficult to accept. Of course, there are ways of communicating truthfulness and conflict situations. Learn those skills, how to do that. Treat everyone with respect, your colleagues, the nurses you see on the floor, and the people that you interact on the phone with. Treat everyone with respect. None of this requires 1 hour of time. Each moment, each communication can be filled with respect and truthfulness if you practice that. And rejuvenate and take healthy care of yourself. How can you rejuvenate? You sleep well. Adequate sleep is essential. As you know, science is telling us clearly. The sleep is not there, your immune system goes out of whack. Your healing becomes out of whack. Your inner peace goes away. When you don't have enough rest, your decision making is not as good. When you're tired, your patience is not there. You're more easy to be provoked with anger, anxiety, fear, frustration, hostility. So rejuvenate and take care of yourself. Healthy nutrition. You're all experts in that. Healthy diet and healthy exercise are very important part of our life. And you don't have to have exercise so many hours at home. You're walking a lot during your work. You may have covered a lot of exercise during the walking itself, but do other things, muscle toning and other things that are necessary for you to really have full care of yourself. Have some form of meditation. And mindfulness is a good way of practicing meditation while you're also doing other things. That's very important. Do what you do mindfully, and that's meditation. All the benefits of meditation come to you if you're doing what you do, whether you're talking with a patient or reading a book or listening to music or driving a car mindfully. So rejuvenate and take healthy care of yourself. Healthy relationships are very important. Connection is the key for isolation. Physician isolation is not healthy. We are connected beings. We have a common cause that we're all working on, and we need to help each other in a very noble way. Next, please. My closing reflection. The most sacred part of our profession is caring for people in their most vulnerable and fragile times. through our knowledge, wisdom, spirit, and trust. We kindle their hope and healing. Let nothing come in the way of these reverential, fulfilling, and humble healing moments in your life. Thank you very much. God bless you. If you have a minute or two, I'd be open to questions or any comments if I can hear you. So Lisa is our technical expert. Lisa, make it happen. If anybody has any question or any comment or anything personal they want to share, please do that.
Dr. Krishna, thank you so much for sharing your personal journey, your professional journey, and I so appreciate your authenticity. You have led our state and your community with such spirit and motivation and enthusiasm. And so thank you so much for being able to join us again this year. We do have the videos available on mindfulness and on stress and burnout that Dr. Krishna did for us over the last few years. So with that, thank you, everyone. And Dr. Krishna, once again, thank you so much for being able to present this morning for us.
It is indeed my honor, Dr. Alexopoulos and all the audience. Thank you for your patience and God bless you with a wonderful journey of medicine and a fulfilling journey for each one of you. Happy New Year. Thank you. Thank you, Lisa.
Yes, sir. Thank you very much. There's lots of people that are expressing their thanks to you in the chat and saying this was a wonderful presentation.
Thank you so much. Thank you.